Today, I'm going to talk about a cardiac investigation, a specialized cardiac investigation, which is called ELR. ELR stands for External Loop Recorder. It is also called ECM, External Cardiac Monitor. So what is an ELR or an ECM, and what exactly is its use, and how can it be advantageous for us in diagnosing cardiac conditions? Now, what happens is certain symptoms actually are episodic. In other words, they happen at intervals and not always present. For example, palpitation. You may be getting palpitation at times which last for a few minutes and then go off. You may have a blackout. You're not having blackout every day, but maybe once in 2 weeks or once in 7 days. The problem is, if you do an ECG on this patient, it may be normal, because we have to catch the heart rhythm problem whenever the symptoms are happening. But if you're having a palpitation, say for a few minutes, by the time you get an ECG done, that may have disappeared. If you're having a blackout, by the time the ECG is done, you may have actually woken up from your blackout. So that's why we need some sort of monitoring which would be prolonged so as to catch the rhythm problem that's happening in your heart to cause this sort of symptoms. Now, you may have heard about Holter monitoring, which provides a 24-hour recording, and at times this may be quite useful. However, what are the chances that you would be able to catch this rhythm problem in 24 hours? If your symptoms are happening more infrequently, then the chances are quite low. You may not be able to catch this rhythm problem. So you need more extended recording. Unfortunately, Holter monitoring involves a lot of wires and leads being strapped onto your chest. It's quite inconvenient. It's very difficult to walk around and go to the office. Also in a country like ours where it's hot and humid, it's very difficult to be without a bath for a few days. So alternatively, we have something called ELR. And ELR is actually a patch which is just put on your skin and underneath your dress. It doesn't have such wires connected to the patch. And you can keep it for a long period of time. Sometimes this ELR, these patches are waterproof, and you can take a bath or shower while on this patch, while wearing this patch. Or sometimes it's not possible, and you can just take this patch off during your bath and put it back once you have taken your bath. So that's very convenient, and they would be able to monitor the heart rate for a continuous period of time, maybe 3 days, maybe 7 days, maybe 2 weeks, as many days as you want. And the monitoring could be done online or offline. Some patches, some ELRs provide a online monitoring system where all the information real time is transmitted to a server, and they are monitoring the heart rate and would let your doctor know whenever there is a problem. And sometimes some monitors would record it for all the days, and then they would give the data as a whole. You'd be able to go through the data and revise it and see what has been happening. So this is what ELR is, and especially for symptoms such as palpitation or blackout, which happens quite less frequently, ELR are very helpful indeed. And I think it has revolutionized management of rhythm disorders causing palpitation or blackouts.